Today I'm going to demonstrate the proper way to remove a chest tube. Now there are a few things that you need to think about before you do this. First, make sure that you have all the equipment that you need on hand. That includes a suture removal set in case the chest tube is sutured into place, and then all of the dressing materials, 4x4s, tape, Vaseline gauze that you like for the dressing that you choose to apply. The next thing to do is to make sure that you're properly dressed, because these things do tend to splash a little bit, so it's important to be gloved, have your gown on, and preferably a mask and eye shields as well, just in case there's any splashing to your face. Now let me just go through the way I've set up the equipment here. And now this is obviously a mannequin, and the chest tube, as you are getting ready, should be connected to the chest tube collection system. Now the things that you'll need are tape, obviously, and I like to have these pre-cut before I apply it. I don't like to be sitting there holding a dressing in place and trying to tear tape or having somebody else do that. The 4x4 that will be the basis for your dressing, some Vaseline gauze, and what I like to do in advance is to actually prepare the dressing as much as I can. So I'm going to actually wad up a little bit of Vaseline gauze right here in the middle, and I'm actually going to take one piece of the tape that I've got, and I'm going to stick the gauze onto it so that it's all ready to go. And then I have the other two pieces nearby. Once you've done that, you can explain to the patient what you're going to do, because if they don't cooperate, it makes it much more difficult. So just explain that it really doesn't hurt. It does feel strange as it comes out. It only takes a second or two to do it. And tell them that you will have them hold their breath and bear down at a certain point, which is very important. The goal is to try to pull the tube out and get it out before any air can go back in. So what you want to do is increase the pressure inside of the chest, and this is most easily done in a patient who is not ventilated by just having them hold their breath and try to expire against a closed glottis, the good old Valsalva maneuver. If they are vented at the time, then what you can do is have the respiratory therapist do an inspiratory pause so that the intrathoracic pressure is high at the time that the tube is pulled. This makes sure that any residual air in the chest will also have an opportunity to come out. So let's go back to our patient here, and we've got the old dressing off. We've explained everything to them so that they're all set, and we have our supplies all ready at this point. So now the only thing holding the tube in really is the existing suture. So what I'll do is cut the suture, and you have to then, from that point onwards, make sure that the chest tube is being supported by your hand so it's not going to come out. Take your dressing materials, and what I like to do is to actually get it all ready so that I've got it right on the patient, ready to go, held in place. And then, and I tell the patient, get ready, hold your breath, bear down, and as soon as they do that, I pull and seal. So now I have the dressing in place. I've got the first tape strip all ready to go, and then I can grab the other tape strips that I have available here, one for the bottom part, one for the middle part. Now, again, this mannequin, the tape doesn't stick very well. It would on a real person very well. So, this is what we have. So, now to finish up, the most important thing now is to tell the patient how to take care of this, because if they're going to go home, they're going to have this big bulky dressing in place. Our preference is to tell them to leave it in place for 48 hours. Don't get it wet. If they do need to take a shower or take a bath, they can cover it with occlusive dressings like plastic. And then at the end of the 48 hours, they can take it off and just replace the existing material with it. A simple Band-Aid will do. And it is okay for them to get it wet, shower, bathe, swim, whatever they'd like to do at that point. They should have a follow-up visit scheduled so that they can come back in and have the wound looked at. And obviously, if they have any difficulties, if they complain of redness, drainage, they should be directed to look for those items and then report them to the physician on a timely manner so that if any type of infection develops, we can take care of it. That's it for removing a chest tube. It's a relatively simple procedure. It's very, very quick, but the important thing is you need to be prepared.